Hello and good morning, everyone. Welcome to the Liaising Healthcare Platform's newest episode on the social determinants of health. As we've been seeing over the news for the past couple of days among the protests happening in the United States, racism is an issue that has come to light once again to the forefront of our news and in our homes. To better understand how racism, as well as the other social determinants of health, affect healthcare, especially in Canada as well as the US, we have with us today Dr. Kelly Anthony, who's a teaching professor at the University of Waterloo, who specializes in social justice issues, as well as identifying the social determinants of health and helping to resolve them. Thank you for taking the time to join us today, Dr. Anthony.
Thank you, Hussain. It's really nice to be with you, and thank you for creating this forum.
Thank you so much. I think we're just going to be diving right into our discussion. So
Okay.
I'd like to start the discussion off not necessarily on a race or from a racism perspective, but more so on a social determinant one. So given our system's recent affliction with COVID-19, what social determinants and how do you feel these social determinants are impacting the health of our populations most significantly?
Yeah, it's a good question and a big question, lots to unpack. You know, Hussain, we know a lot more in the US about how different socioeconomic groups and racial ethnic groups are experiencing an disproportionately adverse impacts from COVID illness and death, because the US collects data on these issues. Canada has been reluctant or slow to collect data on who is affected in terms of an identity or a category like race, ethnicity, or an experience like low income. So we haven't been able to see as clearly the disproportionate and inequitable burdens that fall on some groups versus others, in particular people experiencing poverty and low income. So that's my first answer, is we just don't know enough because we don't collect data on it. Anecdotally, any hospital can tell you they're seeing more people who are living closer to the margins socioeconomically, living with poverty or low income, as people who are, I think before COVID, the estimate was that about half of Canadians were several $100s from having no money, not being able to pay their bills. I think the number was around 200, even if it was as high.
Wow.
I know, that's stunning and startling.
That is really stunning. Wow.
It's very depressing. And of course, many people living close to the bone in terms of not having those resources are also doing more difficult work, more stressful work, and often have more stressful home lives as well, due to those socioeconomic stressors and maybe the stressors of experienced racism, et cetera. Or histories of our colonial past in Canada for Indigenous peoples. So I think there are all kinds of ways anybody in a hospital or on the front line of healthcare could tell you the people who are getting hit the hardest are those closest to the margins in marginalized groups, such as those experiencing poverty. And this is before they even make it to a hospital or to a testing center. They're experiencing those disadvantages.
Wow. So with that sort of socioeconomic like sort of element to it, do you think there's also a political element that would underlie these socioeconomic conditions, especially when we bring ethnicity and race into the discussion? I know you mentioned that we don't necessarily take data on race as the US does.
Right.
But is there also a racial element into these varying socioeconomic degrees, in your opinion?
Yeah, I think that Canada, and I'm certainly not the first to notice this, that Canada has a peculiar reluctance to collect data or ask questions on race, ethnicity. I think many Canadians would say it shouldn't matter, and well, all of us would hopefully say it should not matter. Your race, ethnicity should not matter in terms of whether you're exposed to a virus like coronavirus or whether you experience poverty inequitably or disproportionately. It shouldn't matter, but the fact is it does. So Canada's been reluctant. Canada's uneasy about conversations of race and ethnicity. And I can say that I arrived here 15 years ago from the US, and Canada is, I would say, on the squeamish side about issues of race, ethnicity, which is sad. And I think something we should unpack and figure out why that's so upsetting to us. I think there are scholars, say, Fo Niimi, who is at the Center for Research Action in Race Relations in Montreal,
Mm-hmm.
says we're missing everything by not talking about race, ethnicity in terms of health and race relations and the well-being of people, in particular people of color in Canada. I was not surprised to see that the UN has significant concerns about Canada's unwillingness to consider race, ethnicity as a factor in terms of health disparities or income disparities. And the UN, and also I must say, I thought the term visible minority when I got here, I thought that was rather useless.
I agree.
What exactly does that mean? That's odd, and that came about in the 1980s, and it aggregates people into groups that makes any differences utterly invisible and thus useless for us. So it might be a feel-good term. I think we need to trash that. I understand that Manitoba is going to be the first province to collect ethnicity and race data on COVID. That was just 2 weeks ago or 3 weeks ago.
Yes.
So Ontario has been slow to do this. We say we're going to do it, but we are refusing not to. And I think it's fascinating from a social psychological perspective. I'm a social psychologist, to understand why we are so uncomfortable talking about race, ethnicity. I think if you unpack that, one explanation for that might be that we have a tremendous amount of historical guilt around collecting that data, given our history, the historical treatment, appalling and dangerous and long-lasting harms that we have perpetrated against Indigenous Canadians. There have been those similar sins against Japanese and Chinese Canadians as well. So I think we're just uncomfortable about it, but our discomfort is not a reason not to look at facts. I always tell my students, I don't like ostriches in my class. You can't keep your head in the sand in my class. So if you're going to be an ostrich, you might need to take another class. And I think that Canadians collectively have been ostriches on this one.
In fact, I mean, just a few days ago, Premier Ford said that Canada doesn't have those necessarily the same systemic roots as the U.S. When it comes to racism, which is, I guess, partially true. I mean, our racism is not as apparent, but for sure, we do still have systemic ties. I mean, our entire history, as you just mentioned, with First Nations, would oppose that. So would a lot of the statistics we see for many of our visible minorities, as well as many of our minorities, which includes people of Black color.
That's right. I remember, Hussain, this is an interesting side note, but while I was living in the US and met some Black Americans who had worked or studied in Canada, and I said, did you like it? Did you find it less racist? Was it a healthier society in terms of race relations? And you know what, this was only a sample size of 3, so it's certainly hardly a random sample or a representative sample. But all 3 said, you know, I prefer America because at least I know where I stand. The racism in Canada was invisible and insidious. And I thought that was truly damning. I eventually ended up, of course, moving here and becoming Canadian, but I've been keenly aware of that as much as sometimes Americans will say Canadians are nicer, and then Canadians have corrected me when I first said that. They say, no, we're not nicer, we're more polite. And there's a pretty big difference. So I think for at least those Black Americans, they felt at least the racism in the US is called out. And that's not always true, but that was their perspective. And I thought it was a thoughtful one and a really serious one for us to sit down and think about as Canadians.
And personally, I mean, I think basically my father used to work in the media, so my understanding primarily is that from at least from a media or sort of like a public awareness lens is that if you just look at American media channels, like you got Fox News, you've got you got a gentleman Ben Shapiro, and there's so many other sort of these media outlets that have damaging and harmful just rhetoric
Yeah,
towards minorities, which include people of black color. We don't necessarily have that here in Canada,
yeah,
which obviously doesn't make it apparent, but doesn't mean that it doesn't happen.
that's
Uh,
right.
and I guess that's sort of the dilemma we're in, uh,
That's right.
as you've really nicely outlined. Just to move on, now that we sort of know that these are the racial issues, these are the socioeconomic issues, this is how people's day-to-day lives are impacted. What suggestions or insights would you have on mitigating the effects of social determinants, prominently racial determinants, in Canada?
Boy, that's a big question. I wish I had the answers, but I can offer some opinions, slightly, maybe well informed, slightly better informed given my position in the School of Public Health and working in this area. Um, I think it is long time for us to start even the beginning a conversation about terms like visible minority, considerations like not collecting this data on census data or healthcare data across Canada. Those are the beginning conversations to say, why are there health differences? Why do they persist? And yes, they're worse in the US, no question. But I think Canadians do themselves and ourselves, as a relatively new Canadian, we do ourselves and our population a disservice by constantly making downward comparisons in both the literal and the figurative way to the US. I think we can say, why do we see those race ethnic differences here? Why? Why is that the case? Why do we not see executives, people of color in the highest levels of the executive populations, of executive boards across Canada, corporate boards and Bay Street, etc.?
Mm-hmm.
Why aren't we seeing people of color rise up into those positions? And what systems might we be perpetuating to keep people who are very qualified from getting to those places? And I know I can only distill this to an example in my own life. I take great pride in nurturing students who have promise in my classes. If they show an interest in moving forward and they're proactive about that, I really try to give them whatever supports I can give them outside of the class and of course inside the class to help them meet their goals and achieve their dreams. I do take special time to do that for students of color. They're equally
Mm-hmm.
qualified, but they may need someone to say, there may not be enough people who look like them in the academy to say, hey, I'm a black scholar, you're a black student, I want to help you get ahead. I am not a black scholar. I'm a teaching professor. I am white. I'm Irish. My history is Irish American. When I see those students, I say there may be invisible barriers that I, and maybe even sometimes they, don't always see. So I try to open the door extra wide. It's not
Mm-hmm.
an affirmative action per se, or it is in the finest sense that they are equally qualified, but may need more supports because they may not see others who look like them in the academy or in healthcare or in research. And so I try to be an extra support to them and even to find them a mentor who might be a really good fit or to be their mentor. And I take that responsibility really seriously. That's one way I can start to move towards equity in Canada.
So it's more so just shifting our priorities towards an equity approaching mindset. So it's understanding that we do have a problem. As you mentioned, our data collection obviously is a major issue. Because
That's
of
right.
that, maybe we don't even know what our problem is.
That's
Um, on top of that, then what we need to do is enforce policies and regulations, I guess more so on a populational level, that'll allow us to accommodate people of color who are experiencing racism in a different yet sort of equitable manner.
That's right. That's right. And I think, Hussein, there's a lot of talk and efforts around diversity training, both in businesses and in universities. I can say we now have enough data to say when those are mandatory, they do
Mhm.
not work and they have the potential for backfiring. So we need to be really careful about how we move ourselves forward as a society towards equity. And force feeding is probably not the most effective way to do that.
Mhm. Okay, that makes sense. Fair enough. Would you have sort of a similar opinion on the U.S.?
Uh, you mean in
The dy-
terms of how the US could move forward in this way?
Yes, because they have sort of different dynamics than we do. Because for us, it's a lack of acknowledgement, but for the U.S., they know that racism exists. What
Right,
would your sort of opinion be for the U.S. moving forward?
right. I mean, I think that US is unique in that we have the disease of really unfettered capitalism in the US, and we've seen the damage of the recession, um, the the banking industry's predatory practices, and no one has been held accountable for that. In the all along Wall Street, executives continue to make more money than ever at the highest levels of corporate titans in the U.S. I think that that's a horrible intersection for the U.S., that there is less of a safety net and more of a myth that if you work hard, you will get ahead. And that is not true. The circumstances of your birth and the place of your birth, the location, largely determines your success. And that's even more so in the US. Where you are born determines your life chances. And the US's segregation, from the words of a Harvard scholar named David Williams, who argues that uh, the place you are born, the segregation, racial segregation that Americans experience, is the secret sauce for perpetuating racism in the U.S. And I saw that
Mm.
every day of my life, living in about 7 different major metro areas around the U.S. Segregation kills Black Americans and hurts America.
Un, un, Unfortunately, that is
That's
uh,
the time.
that's the case, and I guess it's good now that these issues are coming to light.
Right.
And I mean just the success of these protests could be measured by the fact that me and you are sitting here having this very discussion that
That's right.
maybe 2 weeks ago we would not be having. It would be on maybe another social determinant, but now
Right.
it's on race. And I think it's really good now that people have just realized that race and discrimination affects every element of their life, whether it's healthcare or their economics, or whether it's their mental health, whether it's their social standing. It could be just about anything. Um,
Right.
on that note, I'd just like to thank you for taking the time to join us today. I know the discussion we've had is important. I know many of our listeners are going to enjoy listening to this, especially from someone who comes from a background such as yourself. And with that being said, I would just like to thank you again for your time, and I think we would be ending it now.
Thanks, Hussein. Thank you so much for taking the time to dig into this issue, and keep up the good work.
Thank you, Dr. Anthony.
All right, you take good
Thank you.
care. Stay safe.
Take care.